كن سعيدا كن فريدا عش بفخر في الحياة لا تبالي فالمعالي بالتحدي لا سواه كن سعيدا كن فريدا عش بفخر في الحياة لا تبالي فالمعالي بالتحدي لا سواه.
Assalamu alaikum wa rahmatullahi wa barakatuh. We want to welcome you again to our series of health and lifestyles. And in today's series, we'll briefly be discussing about healthcare and the importance of healthcare. One, healthcare encompasses several things, and most importantly, it's the ability to maintain your health so that you are healthy. And if you have become sick or you have lost your health, you need to seek for medical, or you need to seek for health assistance so that you can regain or can get back your health. The other thing that is very important is for us to prevent diseases, to prevent illness, so that we do not become sick, so that we maintain our health. And this will encompass the issue of, if you think you have a problem, seeking medical advice so that you can be diagnosed, so that they can know what ailment you have, what is the disease you have, or what is the disease. And in the long run, if we have found that we have a problem, then we need to seek the appropriate management, and this will include counseling and most probably being given treatment in terms of medication. So these are some of the areas that we need to take care of, we need to address so that we can be actually healthy, and once we are sick, we regain our health, and so that, and also we prevent us from getting these diseases. And what is very important for us to be healthy is that we really need to know that we need to demand for the health services. And for us to demand the health services, we need to have the knowledge, the information, what is appropriate health, what is the areas that we need to do, and what are the things that we need not to do. Second thing about getting health or maintaining your health, it's very important for us to have the access to health. And this access is in different ways, but the three most important are: one, having access to a health facility, that is in terms of distance, so that you can be able to get to a physical facility. Two, the access in terms of financial capability, that will be able to have the services because you can pay for it, or it is covered by a certain insurance, so that once you go to the health center, you'll actually be given the services. The other issue about the access is the issue of the quality, the technical aspect of that service. You might be near a hospital, you might be able to get to a hospital, you might have the finance, but once you get to that facility, are you sure that you'll get the quality services that you need? So these three aspects in terms of access are very important, so that in the long run, you can get quality health care in that facility. And this care, we get it from different levels. And the most important level that we get these health services, one is the home environment. Actually, the home is the first health institution. And why I'm saying this is because as soon as one is born in that family, you'll see that the knowledge of the family members, especially the mother, really determines on how much health or how well this child will be taken care of. And this is very important. And also, immediately these house members become sick, there must be some form of initial or first aid activity that will be done to this person. Either the mother will try to cover the child, or if the child is having, for example, fever, the mother might give this child a medication to reduce that fever, or this mother might try to do something in the initial stages so that this problem or that illness does not continue. So it is very important to understand that actually the first institution where health is maintained, where health is generated, is actually the household. And in this, it's very important that the household members, they have the knowledge at least of what are the basic things that they need to do in terms of maintaining health. Then the next level is actually the community, and the community is very important in terms of what are the cultures that it have, the society that the people that are living in. These actually will affect, for example, the health-seeking behavior of the individuals who are sick. It will affect how they go for the treatment or even not go for the treatment. We know in some cultures actually they have something against getting medical treatment, so it also affects. So the community that one lives in also determines on how they'll seek for health care, on how they'll use the health facilities. The next level, which is very important, is the primary health care level. This primary health care level is actually the first point where the individuals, where the people who are sick or the patients actually get health care. These might be actually some institution inside the community. These might be a walk-in, walk-out center. It might be a center where somebody gets medical advice. It might be a center where a person gets some counseling. And it might also be a facility, for example, the dispensary and the what we call the health centers actually form or composes the components of a primary healthcare. And this is a very important level of healthcare because it actually manages almost 80% of the problems that arise in terms of health-related problems before they go to the next level. In the next level, once maybe these conditions need to be referred to the next level, this will be the secondary level. And in most cases, these are hospitals where some form of special care can be gotten. There are more advanced investigations that can be done in this level. There are more interventions that actually can be done in this level. But they also include some services that might not necessarily be gotten or be sought from the health facility. Issues to do with the dental care, issues to do with the psychological counseling, issues to do with nutritional information might also be gotten at this level. The next level, if something maybe needs a very specialized management or treatment, then it will move to the tertiary level. And these are the levels that give very specialized care. And for example, in our setting, we have the treatment for mental health. We have the treatment at the spinal injury. We have, for example, our Kenyatta National Hospital and Moi Training, Teaching and Training Hospital, where they give more advanced, very specialized management of healthcare. So these are the different levels that one actually can seek for medical help. I can look for medical care and also sought for medical advice in these different levels. And one needs to know that it is more important, one, to prevent diseases than to get sick. And we know that once somebody is sick, the issues to do with the individual disability that will occur. This person will be sick, will not be able to attend to his normal day-to-day activity. The society, the members who are around him will actually also be affected because, one, they need to take care of this person. They'll also incur a cost in terms of their time. They'll also incur a cost in terms of taking care of this person. And also, they'll incur a cost in terms of taking this person to the health facility so that they can be treated or they can be managed. And we know that, so prevention actually with the things that can be done is better than getting the cure. And we have mentioned in our earlier series in terms of hygiene, in terms of maintaining our cleanliness, which is very important. Physical activities, we need to be physically active so that we can reduce some of the diseases, especially currently. We know many of the non-communicable diseases are caused by our way of living in terms of what we feed, the sedentary life that we sit for a long time and we do not have any exercises for a long time. These actually lead to issues like malnutrition, obesity, people becoming overweight because they do not exercise enough. So it is very important for us to do the preventive aspect so that we do not get sick. Once one is sick or has been managed, there are things that actually can be done at the community level, issues to do with the community rehabilitation. These are things that once maybe you were managed for a fracture or a person was managed for a mental problem and now he has been sent back to the community or to the household. This is a place where the people, if they know what to do, they can actually help in the faster recovery and getting back into normal life of a person because of the social support that they have, bringing the person back to almost normal like activities that the person used to do, because we know in a facility setting the person is confined, the person is actually being managed, and he cannot do the normal activity that he or she used to do. So it is very important as early as possible that this person, after being managed in a facility, after being managed in a hospital, that he's sent back to the community so that he can be integrated very early enough and can have that social support. And we know that there are other sectors also that really affect health. And for example, the school environment, we know the children in the schools are given knowledge in terms of health-related issue, but also more importantly, they are encouraged to do the physical exercises, which they need to do maybe once or twice in a week. These are very important in terms of training these children for having an active life, for putting them into exercise mode early enough before they become old. And this helps them in terms of maintaining their body weight. This helps them to have the more energy, and this is very important for their day-to-day living. So they need to continue with this activity. We know other sectors, for example, the transport sector is very important. The roads that they make in terms of, do they have access for people to walk? Do they have lanes for motorcycles, for example, to ride on? Or do they have lanes for the bicycle? This is important because it encourages the people to have more activity. It encourages them to walk once they are moving from one place to the other. If the roads are not having this access for people to walk or to cycle, they will not be encouraged to do these exercises. We also know that these roads are very important in terms of getting access to the facilities. If these roads are not proper, if these roads are not passable, it means that there will be a delay for these people from moving from one area to the other, from where they are once they are sick to the health facility. So the infrastructure also of the road is very important. We know like a sector or like agriculture is also very important because it helps in the nutrition aspect. Welcome back to our second part of the series where we are talking about healthcare. Just before we went for break, we were talking about some of these other sectors that are very important or they affect health. And it's important to know because one way or the other they contribute to whether we become healthy or not. We have talked about the road infrastructure, and this is one area that is very important in terms of enabling us to get access to health. We know that if, for example, somebody is sick and is in their house and he needs to be moved from their house to the facility, to the health facility, and the ambulance cannot get around to that house, it means that this person might not get to the facility in time. This person might lose very important crucial minutes or hours, which might actually have determined whether this person lives or not. We know that these roads, for example, if they have access for people to walk, they have lanes for people to walk, or they have lanes for motorcycles and for the bicycles to move. It will actually encourage the people to be more active because they have a path where they can actually walk. They'll have a path where people can either ride the motorcycles or the bicycle. And this has been shown in other areas that it's a very important way of encouraging people to have physical activities. Because when these are not there, it means that the people will not be encouraged. They'll actually be at more risk of having accident because all the vehicles will be at the same lane where the people are passing. We know a sector like agriculture is very important in terms of giving us the food security. This is the issue of having enough food and the food that is available and reaching to the people that who need it. And also agriculture is a sector that is very important in terms of giving us a nutritional security in terms of the appropriate nutrients that are actually required by the person, by the individual to maintain his health, but more so once this person is not healthy. We know a person who is not healthy will need even extra nutrition so that he can actually have more vitamins, more minerals to fight the diseases. He will have more energy to come out of the disease and have more protein that will help this person in building the body, to repair the body so that he can come out of this illness or the disease. We know other sectors like the economic sector is very important that this is supporting the people to have access. If people have access to finance, they'll be able actually to get the health services. They'll be able to move from one place to the other, especially in terms of seeking the health facility. So the economic aspect is also important. It supports a lot. And we know poverty is one of the main factors that actually make people not get access to health services because of the cost intended there. So the economic environment is very important. The general environment in terms of where the person has come is very important in terms of prevention of further illness or preventing reinfection. For example, if a person got sick and he has or she has malaria because of that area had stagnant water or that area had a lot of grass or bushes, it means even once the person is treated in the facility, when he or she comes back to the same environment, it will be very easy for the person to get reinfected. It will be very easy for that person actually to get the same infection that he got from that society. So this general environment is very important that it is taken care of, it is maintained well, and it is put in a manner that actually it will support people being healthy. And we know that the cultures of the people around the people actually affect very much in terms of whether these people will seek health or not. And we need to actually encourage the positive cultures. We know there are positive cultures in terms of eating organic food, eating our traditional food, which actually used to encourage us to have healthy lives, to be healthy. And we know that there are other cultures that encourage, for example, breastfeeding for at least 2 years. This is very important for the child, but without giving any food, the first 6 months is very important. But the negative cultures that actually prevent somebody from getting health care or somebody seeking for health care, these are the cultures that we can actually reduce or remove completely. We know there are some people who actually will not want to go to the hospital completely. We know there are some people will not accept to be transfused, even if it's really needed and it is life-saving. So some of the cultures are positive, some of them are negative. The negative ones, actually, we need to reduce. In terms of health care, what is very important is that we need to know that what is it, some of these things that we need to do so that we maintain our health. And some of the things we have mentioned in terms of appropriate nutrition, in terms of physical activity, we need also to be alert and cautious in terms of going to seek for medical services, not just when we are sick. Issues to do with the medical checkups are very important. Issues to do with screening are very important, at least once in a year. And in these medical checkups, it's important to know, for example, what are your vital signs in terms of how your blood is moving, how high or how low it is. It's very important so that it can be corrected early. You need to know what is the level of your blood so that it can be corrected if there's a problem. You need to know the composition of your blood. Issues to do with fats, issues to do with the lipids in your blood is very important to know whether they're high and if they are high, what are the measures that you can do, and what medication you can be given. So it's very important. In terms of screening at different levels, we know that we can be screened for issues to do with different conditions, and for our general population, for example, our women, we know they can be screened for breast cancer. This is very important, especially in their reproductive age. They can be screened for their cervical cancer, so that at least if there's any issue, it can be managed early enough. We know once it is late, it becomes complicated, or it reaches a stage that actually it cannot be managed. So it is important for them to have almost yearly check once they're sexually active, so that it can help them. For the males, it is important, especially the ones above 40 years of age, for them to be checked for prostate cancer, so that it can be managed early if there's anything, and if it is not there, they can be encouraged to continue with the positive living. So some of these screenings are very important, and medical checkups that they can get issues or conditions at an early stage. It can help in appropriate management and in good time. So it's very important. We know for our children, they need to be given their immunization. There is actually a routine immunization schedule that from birth up to around 18 months, there are different vaccines that need to be given to the child, which will prevent conditions like polio. We know polio is preventable with immunization called BCG, so it is important for the children to get that. You know, the children can be given immunization to prevent pneumonia, which is one of the major killers of children under 5s, so that they are protected from getting pneumonia. They can be given vaccines to do with the flu, so that they do not get influenza, and it protects them. They're given immunization to protect them from measles, so that they do not get measles easily. So it is important as when appropriate time for these children to get this immunization, they are taken to the facility and they get this immunization, so that they can prevent diseases that are easily preventable by these vaccines. You know, for elderly, also the pneumococcal vaccine, it's important for them. It has been shown it to prevent them also from getting pneumonia. And this is important because the elderly, they easily get affected. So some of these diseases that can actually be protected by vaccines, and also the TB, it's important that the children, the elderly, they get these vaccines so that they do not get sick. And at each different stages for the children, we need to seek medical advice for them early enough once they get sick, especially with the children when they get high fevers. These are things that can actually affect them very fast in terms of their ability, physical ability, in terms of their mental health. It can affect them, and it can actually be permanent if it is not managed early. So these are things that once we see them in our children, we can actually seek for medical attention very early. And for our youth, we need actually to be concerned about how they use issues to do with the substances, which can actually lead to some substance-related disorder, so that we become a bit cautious with them. And if there are any signs and symptoms that these people are changing or using them, we can actually correct them and give them the right medication. In terms of once a person has been given the medical treatment, if they need rehabilitation, the best rehabilitation is take this person to the community so that it can be rehabilitated. This person can get back early enough, can be integrated into the community, and this person can actually start doing the normal activity that the person used to do. This will encourage the person to recover early. So this is very important in terms of bringing this person, rehabilitating, and taking care of this person at home. In terms of issues like the mental health, also it has been shown it's very important for these people to recover once they've been given medication. The best support they can have, it is back at the community, in their household, in their home environment. This helps them to recover early. So this is very important. So in terms of getting healthcare. One, the household, the people need to have the knowledge. They need to seek the health knowledge so that they know what to do. The community around should be a community that has positive cultures so that it can help the individuals, the household, and the society in general to get health facility. The health system at a different level should be supportive of these people to get this health care at the different level, whether it is a primary health care level, whether it is the secondary level, or whether it is tertiary. So all this level, it is important for them because in totality, they're the ones that will help the people, the individual, to get health. And what we really need to know is that it's very important to prevent diseases instead of waiting until you become sick and cure them. So it's very important for us to remember that prevention is better than cure, so that all the time we can prevent diseases and maintain our healthy lives and become healthy. With this, we'll be breaking until our next series, and next time we'll be talking about substance abuse. Shukran. السلام عليكم ورحمة الله وبركاته.
كن سعيدا، كن فريدا، عش بفخر في الحياة، لا تبالي فالمعالي بالتحدي لا سواه. كن سعيدا، كن فريدا، عش بفخر في الحياة، لا تبالي